Hi there, I'm Dr. Chung and welcome to your friendly proctologist. This channel is about improving your anal health and improving your anal quality of life, right? Our anus can do so many distressing things to us, and that's what this channel is about, to help you. And so I really appreciate it if you subscribe to this channel. It will allow it to grow and reach many more people like yourself who want to learn about their bodies but also help themselves in times of need. So please ring that bell, please leave a comment, like the video. I appreciate you so much for joining me today. Today's topic is about breathing. I tout on and on about deep breathing and the benefits of it, but what the heck does that even mean? I mean, I'm breathing 10 times a minute, so I think I've got that certification down, right? Well, the deep breathing I'm talking about is a little bit deeper than that. And it's a little bit of applying your mental health into it. So not just the sake of getting oxygen to our blood, but most importantly, achieving that mental relaxation, decreasing our stress, increasing that ability to relax those muscles, especially in our pelvis and our anus, which need to be that way, meaning relaxed, so that you can have a very easy bowel movement. And then, of course, after the bowel movement, to allow that pain level to be lower and to recover faster from a flare. So, how is deep breathing done? Okay, what is it? Well, in my opinion, deep breathing is by going in through your nose. It can also be done through your mouth. But you breathe in for about 3 to 4 seconds, okay? And the idea here is not just to breathe just with your chest, but continue to fill up your chest. And what you'll find is that your belly also will bloat. And your pelvis may even start to fall down. You may feel pressure down there because the body is starting to really fill your lungs up to the maximum capacity. And when there's not enough room in your chest, it starts to push down into our bellies down below, okay? When we're exhaling, what happens there is all that air you breathed in is now going to leave your body, right? Your chest is now going to get smaller. And all that pressure that you had in your belly from bloating, your pelvis lowering down, well, that's also going to leave with it, and it's going to be an action that takes twice as long. So 6 to 7, 8 seconds of exhaling mode. Okay, and so to demonstrate what that looks like, I've got my little prop here. Hello, Mr. Latex Examining Glove, right? So he's a circle and a bubble here because this is meant to represent our belly. Okay, we have our backbone to support us at our back, but everywhere around here in the belly is very soft. There's no bones out here, and up here we've got our chest. These lines are meant to be our rib cage, and here's our center belly button. And I have written down here, it's reversed, but pelvis, or the anus, down below, because the bottom of our pelvis has no bones. It's all muscles and soft tissue here, so it's going to move up and down. So let's go over that deep breathing, okay? My hand is going to represent the diaphragm, which is that muscle that separates the chest, the lungs, from our belly, okay? And as we breathe in, that diaphragm is going to push down on our belly because the lungs are trying to blow up and expand. And this is what I mean when if you just fill up your chest, your diaphragm doesn't move all that much. But when you continue to breathe in, you'll find that your belly you can't help but see that belly here, you see that? Starts to come outwards. And that's what we really want to see. If you allow that to happen, eventually you're going to see that the pelvis also drops down, and that's another phase of that deep breathing. So what are you noticing here? How does this bloating or balloon action happen? Well, it's happening because your muscles are relaxed. If you do a sit-up, you get that washboard stomach here, and you try and breathe in, that diaphragm may push down, but that belly is not going to expand. It's blocked by your back and blocked by the front abs being contracted. But if we were to allow that belly to bloat, that relaxation is now intact. You're doing it. And then the same thing for our bottom end. If we squeeze our bottom end as we're breathing in, we can prevent that diaphragm from pushing the air down into the pelvis, okay? So ideally when you're breathing in, we want these cavities of our bodies, different parts, to bloat out. And how is that done? Through the muscles relaxing, because contraction or strengthening those muscles will not allow that flexibility for things to pooch outwards, okay? Then as we exhale, right, the air leaves the body. The diaphragm, instead of pushing, now lets go and starts to lift up, okay? Because the air is leaving our lungs and our chest is starting to get smaller. So as this pressure lets up, all this bloating here will start to lessen up and things will go back to where they started. And one person in the comment asked, what's better? Is it better to poop while you're breathing in, or better to poop when you're breathing out? Because I'm not sure when to relax or what's the best time to do it. And from my example here, it seems like breathing in, filling your chest with air, allows everything to pooch out, and so everything is relaxed. Aren't you saying that that's the best time? Well, not exactly. I mean, I just explained the dynamics here of what's happening, but in reality, the best time for you to actually relax and poop is whenever you feel the most comfortable. Sometimes blowing up all that air, the body reflexes and wants to contract again. It won't allow that bloating to happen. And that's okay. Sometimes it may be new for you and it's a foreign feeling, right? And that is actually a skill that may take time to learn. I think deep breathing, just like meditation, it really takes skill and some learning and connecting what you feel in your brain to what you feel in your muscles in your body. And it's something that occurs with practice and with time. And so I think in the meantime, whatever phase of breathing is working for you to feel relaxed and to allow you to have a bowel movement with less pain is a-okay, you know? Because in reality, it's not like we wait to breathe in to poop. We just kind of let things happen, right? And that's what we want, is an automatic thing where it just, we sit down in the toilet and then we relax and we do our job. And so I think that just the action of breathing in and out is to prepare our body and our digestive system, the pelvic muscles, the anus muscle as well, to relax, drop down, and let your poop pass, right? And that is a pretty big summary on the deep breathing and how it can be used. Because when you're laying down after a bowel movement because you're having pain, the deep breathing again allows that anal muscle to relax. Because if it's squeezed down real tight, it is crimping and just squeezing to death that wound, which if you were to push on a cut on your arm, that hurts. You say, ow! But the anus does the same thing, and so we want that to chill out and allow it to say, it's okay. You don't need to squeeze the life out of yourself. Just relax. Things are okay. We're going to get better. I hope this video has helped you to understand what I mean by deep breathing and given you shed a little bit of light on the topic. It does take some time to learn this skill well, and I hope that it helps you in the long term. Thank you so much for watching. I really appreciate you, and take care. Bye-bye.